Hello guys, I'm Dr. Diego Marquez and I will be explaining a little bit about crown preparations and crowns. So a lot of our patients walk into our office, sit in the chair, and one of our main concerns is to explain to them further the type of restoration that they will be getting. A lot of time they want something specific like a crown, or sometimes we deviate and we restore through ceramics or veneers, something a little bit different. But let's talk about crowns. A crown is the protection or the covering of the whole structure of the tooth with zirconia, with full ceramic. It could be metal fused to porcelain, which is the conventional type of restoration that has been going on for a lot of years now. Some being more aesthetic, some being more resistant, but with the main idea of protecting the tooth and restoring, obviously, the function and the aesthetic of the dental organ. So when we prepare the tooth, we purposely wear out the tooth to get it ready and leave space for the future restoration. And we obviously numb the tooth or the area, and in case the tooth needs it. Some teeth don't need it. They already have root canals, for example. But we prepare the tooth. We have to have ideal gum health. You know, we really focus on that. That's very important. And a lot of patients come in, they don't have healthy gum tissue, and we sometimes have to postpone the impression of the teeth. Why? Because if we take an impression like that, our gums are going to be modifying in height or getting swollen. The margin of our crown will change, and it will expose the ceiling of the crown, which will affect the longevity of the crown. So yes, we do focus a lot on the gums, that being one of the foundations of the tooth. So once we get the impressions going, we send them off to the lab. The lab does a lot of the artwork on the crown, and in another appointment, we cement the crown, test it, obviously, check the color, check the bite, and if we like it, we cement it. If we don't like it, we go back to the technician for minor adjustments, which happen sometimes. But, well, I hope that explains a little bit more about crowns. And we'll talk about ceramics another time, and onlays, veneers, and things like that. Thank you guys.